it's amazing how technology really spurs in the face of something like the pandemic. Prior to the pandemic, a report out from McKinsey said at the time in 2018, about 43% of a healthcare's operational practice has high automation potential. But there's really no real drive to do it, because at the time, healthcare system was really trying to optimize their business as much as possible. During the pandemic, we saw a shift. It moved from 43% opportunity with less than 20% looking at automation to McKinsey coming out with a report saying in 2020 that 60% of healthcare CFOs planned on making an investment in automation over the next 3 years, and their projections are really spot on. Actually, 60% is a smaller number to what we've seen, and automation is applicable across the enterprise. A lot of businesses look at it just maybe in denial management. Some of them might just look at it in supply chain. Those are two prime areas that we see a lot of opportunity, and we see a lot of our business in today. But we also see it in IT. We see it in HR, especially now with workforce constraints. We see it in areas like finance. We see it in the lab. We see it in radiology, and especially clinical areas where our physicians are going through burnout right now and spending those extra 2 to 3 hours to pick up the slack of the administration that unfortunately is no longer with them. So we're seeing an order of anywhere between 1,000 to 2,000 prime use cases coming out in the first 2 years within these health systems when they're using our platform. $265 billion administrative cost out there right now, right? I mean, this number doesn't surprise anybody. I think most people, the B is actually, the B of billion should, feel like it should be more like a T in trillion. That's about $265 billion right now. More than 40% of that administrative costs are just repeatable, standardized processes. Now, I don't want to make it sound like automation should only be for repeatable, standardized processes. But that's really where it shines the most. We call that low-hanging fruits, right? If there's a standard way of doing a piece of work and it's done on a computer system, you can automate it. So 40% of that is standardized enough to automate. This is where it really meets into healthcare, because it really applies to every asset of the business to reduce that administrative cost. That could be labor cost. Again, I'm not necessarily saying we replace people. It's cost avoidance, the people we don't have yet. We have a shortage here. A big shortage. It also reduces the cost of technical debt. Most hospital systems have 300 to 400 different applications. Most of them are middleware. Automation takes care of that cost in the millions. And it also optimizes the clinical technologies we use, like EMRs, EHRs, PAC systems. They're not very well integrated. We're coming into the world of open APIs and FHIR standards and interoperability. These are all great things that we want to happen, but healthcare isn't really well known for adopting technologies on day one. We're about 10 years behind everyone else. So they're finding that automation is a quick way of bridging that gap to adoption and getting the efficiencies they need. And that's just the cost side. Think about quality. Robots tend not to make mistakes as much as people, I know I make a lot of mistakes. I use robots a lot, so I could take the risk out of the work that I do, right? Quality reporting, cycle time, right? There's a lot that we do that is very time sensitive, especially during COVID with regulatory reporting, COVID reports, PPE allocations, all these things had to be reported on a 2 to 3 hour cycle every day. There is, I think people wonder how organizations were able to meet that need, and they used automation heavily to drive that. So there's a lot of quality aspects that automation brings into healthcare, which I think is very important today.